Hi, everyone. We'll go ahead and get started in just a few minutes while people are still hopping on. All right, let's go ahead and get started today. Hi, everyone, and welcome to Step into Severs. Today, we'll be talking about how the Mikki Device helps young athletes with Sever's disease. I'm Brooke. I'll be your host for today's session. My job here today is to represent you, the parents, the coaches, and the trainers. First, we have Dr. Mikkel Jarman. He's our Pediatric Medical Director. He is the one who sees the clinical side of these injuries every day and knows exactly what's happening with those growing bones and joints. You'll also see Scott Kelly on this call. He manages our Pediatric Orthotics lab. Scott is the maker, or the guy who takes Dr. Jarman's clinical goals and turns them into a physical device that actually helps fit into a shoe and helps heal children. So to get us started, Scott, could you tell us a little bit about your lab and your role with Pediatric Orthotics?
Yes, good afternoon, everybody. My name is Scott Kelly, and I'm the manager at Pediatric Orthotics. Since launching 4 years ago, our company has been dedicated to helping children remain active, healthy, and pain-free through innovative custom orthotic solutions. Our mission is centered on improving mobility and quality of life for children experiencing foot and heel pain, especially young athletes with conditions such as Sever's disease. What makes our company unique is that the same custom orthotics that are trusted and prescribed in local podiatrist offices are available online to children and families around the world. Our most widely used product is the Mikki Device, developed specifically to help children experiencing heel pain associated with Sever's disease. We have seen how this device has helped children return to sports, daily activities, and active lifestyles with phenomenal success. Because of these results families continue to experience with the Mikki Device, we proudly stand behind it with a money-back guarantee. While I'm not a physician or medical provider, I've worked closely with podiatrists, parents, and children in the field of pediatric orthotics, and I've witnessed the positive impact proper orthotic support can make for children diagnosed with Sever's disease. So thank you for having me on, and I'm proud to represent Pediatric Orthotics and the work we continue to do to help children around the world stay active and pain-free.
Thank you, Scott. That's fascinating. It's amazing to hear about the nuts and bolts behind that Mikki Device. Really interesting to learn about. Thank you so much for that. Dr. Jarman, this is where I'm going to hand things over to you. As our medical director, you're seeing the injuries and the pain points that led to the creation of the Mikki Device in the first place. Could you tell us a little bit more about Sever's disease and how the Mikki Device helps?
Yeah, absolutely. Thank you, Brooke and Scott, for allowing me to be on this this call with you guys and kind of this this clinical webinar. I'm very passionate about this condition, and it's something that I hope in this webinar I can kind of spread some good, reliable information out there just to help, understand what Sever's is, differentiate it from the different types of Sever's that exist, because Sever's is not a universal condition, and the solutions that exist, and very specifically the Mikki Device and kind of why that exists. So what is the Mikki Device? Why was it created? And so it actually is a passion of love in how this product came about. So I am the founder of the Mikki Device. And in 13 years of private practice and 3 years of residency on top of that, and another 4 years of med school on top of that, or podiatry school, I have come to this conclusion, or came to the conclusion, is that there's a lot of inconsistencies in orthotic management for this condition of Sever's, and that manufacturers of orthotics just could not meet the needs to control this condition or solve this condition in a conservative way. And so this unmet need is what had created this device, this orthotic device. I needed a device that could take the pressure off of this injured bone, this heel growth plate, but still allow a child to run, jump, and be a kid and do normal things. And so this is where the Mikki device was born and how it was created. And so with Scott's help and Pediatric Orthotics is the manufacturer of this device, is that we have been able to create a device that has standardizations within it that are tried and true, that are proven to control and eradicate, this problem. So what is Sever's? And so Sever's it's a bone injury. It's a heel bone injury. It's not a soft tissue injury. It's inflammation in this growth plate that exists on the back of the heel. And on this slide, we can see there's an x-ray. This is called a lateral view of a child's foot. And we see this growth plate. And this is about an 8-year-old child. And there's a gap that exists there. And you see this black arrow. That gap is the growth plate. That white cap, that's part of the bone. And it's that gap that gets irritated, that becomes inflamed. It's important that we understand though, is that this irritation, this injury is the most common, like heel pain. It's the most common injury in these children that are complaining of heel pain. It comes from this place. It's amplified and triggered with growth and activities. The Achilles tendon, a tight Achilles tendon, they're triggering events, not necessarily cause, but they're triggering. We'll see that it peaks at different ages, but we do find it in this age range between 6 and 14. And the interesting about Sever's is that heel pain is a like 2 to 3 out of 10. It is not a screaming 10 out of 10. It's the compensatory pains of the child not walking normal, walking on the outside of the foot, walking on the balls of their feet, limping around. It's the tendinitises that will go from this 0 to 10 that are confusing to parents. But this shifting pain that is all around this child, it's confusing to help, in diagnosing, I guess, this Sever's. So what causes Sever's? There are 3 causes, and it can be one of them, or it can be kind of a combination, but it's a triggering event. A child jumps off of a ledge. They land really hard on this growth plate and they just drive it into the ground. It's repetitive energy that comes through that heel, that growth plate, running, jumping, soccer, football, basketball. It can also be attributed to the gait of how a child walks. Now, the other aggravating factors are going to be growth, repetition, a tight Achilles, hard surfaces, poor shoes. Those are aggravating. But the cause is always going to come down to triggering events, repetitive energy through that growth plate, and gait. As a parent, what we're going to see is heel pain after activity. You're going to see this child complains after a sport where they're limping, they just can't walk normal. They're walking on the outside of their foot, they're walking on the toes. You're going to see that there's some swelling. There's these shifting patterns of pain, that come from the heel, not just the heel, but maybe the knee, the hip, the back, whatever. It's this number 4, though, is that we need to be, as a parent or as a coach or as a physician, we really need to be dialed in on is, do they have heel pain? And if they do, we really need to have this Sever's as the foremost diagnostic or diagnosis. So why are these children so difficult to work up, though, for Sever's? You would think that, a child would be able to articulate their pain. They're going to point to it. They're going to say, right, my heel hurts. And early on, they actually do say this. They say, my heel does hurt, and this is inflammation in that growth plate. It's on the back of the heel. And again, if you squeeze it, you'll identify it because that's the classic location. But what you're going to actually hear the child say is, my knee hurts today. My shins are sore. My legs are tired. And they may often forget to mention the heel, but the heel pain is there. It's just that the heel pain isn't screaming as loud as the compensatory pains. So as a parent, we become confused and we say, wow, Sally's, foot hurt on the front of her ankle, and now her calf hurts, or Achilles hurts, and now it's her shins. And so we get worried as parents are these growing issues? Is there something wrong with my child? We take them to doctor visits, and you'll get multiple different appointments. You'll go to the best of the best children's hospital, and you'll still walk away feeling like you don't have answers, because it's common to chase things that from the doctor that look obvious. Oh, your child has a flat foot. Oh, they have growing pains. There's sometimes to be that missed attribution of cause. And so we have to be careful about that. So the calcaneal squeeze test is the diagnostic factor for Severs. It's not x-rays. It's not imaging. It's just a good clinical evaluation. And you perform this by having a child sit on a chair, sit with their legs hanging off a table. And like you're holding a tennis ball with your index finger and kind of your finger and your thumb, and you're squeezing it like you'd squeeze a tennis ball, but you're squeezing it right there on the very back of the heel. And you have to squeeze on the growth plate, because if you're up by their ankle or you're out in the midfoot or in the calf, you're going to get a false reading. A positive test will reproduce this familiar pain that a child has. Now, you have to remember, they have compensatory pain. They have calf pain. They have shin splints. They have pain on the front. They have pain on the outside of the ankle. They have pain on the ball of their foot. They have pain everywhere. But they're going to have this familiar heel pain when you squeeze that, because in the Sever stuff, when it calms down, the heel pain doesn't go away. The noise will calm down, but that heel pain just doesn't go away. And again, it's not always a 10 out of 10. It's like a 2 out of 10. So that confirms the calcaneal apophysitis Sever syndrome. Now, if it's negative, like they don't have Severs and they don't have pain, well, then we can consider other diagnoses. Okay, maybe it's a flat foot. Maybe it's a coalition. Maybe it's tarsal tunnel. There's other things that kids can have that mimic the same condition, though the odds are statistically it's Severs. Now, this plantar fasciitis, I'd like to talk about this, because this is a huge misconception in the medical community that these kids really have plantar fasciitis. And because as a parent who's experienced plantar fasciitis, we're going to mimic what we feel and think that our children have. And so if you look at this image here on the right, you see a child with Severs, and we're looking at this red irritation on these feet, these diagrams. And you're seeing it's going to be isolated around that heel growth plate, and it will come up the Achilles. On a child or on an adult with plantar fasciitis, and in that world, you're going to find is that there's no growth plate. So if there's no growth plate, they cannot have Severs. You can only have Severs if you have a growth plate. So the plantar fascia pain is along the plantar fascia at the insertion onto that calcaneus. But the plantar fascia is an incredibly strong connective tissue. It is a steel cable. It does not stretch. It will tear, but it takes tremendous forces to tear this or to injure this. Whereas a child's growth plate, and those of us who see children see this every day. In clinic today, I saw 3 kids with growth plate injuries, because growth plate injuries are really easy, because growth plates, you can see through them on an x-ray because they're soft. They're not hard bone. So in actively growing children, these open growth plates, they're soft, they have less strength, they're immature collagen, there's a lot of water content, and they're very, very vulnerable to this repetitive force. So the growth plate will always become aggravated and injured, always before the plantar fascia could become injured. So another differentiation that needs to be made in the Severs world is this acute versus chronic Severs. Because Severs is not a universal word in the sense of everyone experiences Severs the same, at the same intensity or the same type. So there are 2 variants of this condition. In the acute, it's inflammation. It's a flare-up. It happens quickly, typically through triggering events. But you will find is that you can ice it and elevate it and ibuprofen it, gel heel cup it, stretch it, compress it for the swelling. And within a day, an hour, a day, a week, it resolves. It isn't something where in the chronic kids, it's a higher level of injury. It's a bone injury where the bone is swollen. It is so angry, and it's a persistent, reoccurring, progressive pain. These children with chronic severs, when they wake up in the morning, they have it. When they go to bed, they still have it. But again, it's not a 10 out of 10. It's this dull 1, 2, maybe 3 out of 10 that just experience all the time. And it's just a normal part of life for them. It's only as they start to increase the athletic activities and they compensate, again, it flares up and is visually present or auditorily present for the child. So this comes down to the solutions. Now, it doesn't matter. It does matter how you solve it. But if you understand that Sever's is a bone injury, all you have to do is get the pressure off of it. So early in my career, when I was trying to treat these kids and failure of orthotic, because we didn't have the Mikki device early in my career, and these kids would fail and fail and fail. So I became reliant on boots, as do most providers do. But the issue with a boot, when you put a boot on, they feel great till you take it off. And in these children who are getting Severs from repetitive forces, they relapse very quickly. I used to put casts on these kids and I would cripple them down because it's a bone injury, and they would do fantastic after they come out of the cast. And it was wonderful, but then they would relapse. So the relapsing of the Severs was concerning because it was concerning to a parent because the problem hadn't been solved. They spent all this time and resources to solve something and it wasn't solved. And so in the Mikki device, you have contouring that moves pressure. It moves pressure off this growth plate and it redistributes it somewhere else. And that is incredibly effective. And that is what makes and breaks an orthotic. 2 is that it's activity compatible, meaning you can put it in your normal shoes, your sports, your athletic shoes. You can put it in your cleats. 80% of shoe gear it will fit in. And so that's wonderful. And that it's purpose built for pediatrics. And this is how we dispense the device. It's 3/4 length. It'll fit into any shoe, or it'll fit into 80% of the shoe. When you start getting to full length orthotics, which are designed for adults, by the way, it's not great. There are times and purposes where you want a full length, and you can make a Mikki device full length, but really it's a 3/4 length is what you want. And that creates the versatility of these devices. And it's just been a tried and true product. So again, how does this work? So the problem is the heel growth plate is being overloaded. There's so much pressure coming through that with the ground reactive forces that are jamming up into that heel. The Achilles is pulling. It irritates this growth plate. The Mikki device is a custom fit device. A mold has to be made of the foot. You then have to make a pocket or a recessed heel cup that removes that pressure off that growth plate, and then it throws it somewhere else. Throws it to other places, such as the midfoot, the forefoot, these other structures. They're mature. They're capable of handling these forces without being overstretched and flaring up. And the result is it's reproducible. It's reproducible on my end is that you begin to heal this growth plate and that these children excel very, very quickly. We're not talking months it takes from the recovery. We're talking weeks. You see this process happen day by day right in front of you. Here in my clinic, when I see these kids, right, we take a mold of the foot. We send it to the lab. We use Pediatric Orthotics, of course. When we get that device back, we then fit it into the child, making sure that child brings in their shoe to make sure it fits into those shoes and their sports athletic shoes. And then we educate them on how they can return back to school because there's no break-in on these. We just say wear them. If they're going to cause a problem, we want that to be discovered right away. But the beautiful thing about these products, because we're actually taking a mold, you have a product that is custom built for this actual device. It solves these real problems. And so in the clinic, in real world experience, and this is 13 years of seeing kids every day, I get to see 2 to 3 kids every day with this condition. 100% of these kids are treated with the Mikki device. We get to see the success that in 2 weeks that they will show this 50 to 70% improvement. And then by week 4, that they're controlled, that their symptoms are controlled. They're running and jumping and doing athletic activities, and their heels are not the source of the problems. But it does take time for that growth plate to completely heal, which typically takes about 3 months of wearing this device consistently. In our end, orthotics will last a child about a year, year and a half. So a Mikki device will last a child about a year, year and a half, and we encourage them to keep wearing that device. But they don't need a new one. There are kids that will re-injure the growth plate eventually again, and maybe a year later when they come out of the device. But we find that these children do exceptionally well with these devices. So the takeaway here is that Sever's is the #1 cause of heel pain in active children between the 6 to 14. And that when you have a child that's complaining of heel pain, you have a child that's running out on the soccer field and they're limping, or in the basketball and court and they're halfway or they're half an hour into the game and they're just walking, or they want to be sidelined. This is Sever's. This is calcaneal apophysitis. This is an injured growth plate. It is not plantar fasciitis. And that children are horrible historians. They don't accurately articulate what the source of the pain is coming from. They kind of do, but then they kind of don't, because the curveball is that, well, it's my knees that hurt, my shins hurt, my ankle hurt, the outside of my foot hurts. And you'll see these children walk too, and as they're walking, you're like, I don't know, is it the flat foot? I don't know, they're walking all goofy, or they turn their feet in. What is it? You just don't know, but it's them compensating. Rely on the squeeze test. If the squeeze test is positive at that growth plate, it is Sever's. And if you treat it as Sever's, the noise goes away. Differentiate this acute from chronic, and understand that when you Google Sever's online, is that you're seeing acute modalities: ice it, rest it, ibuprofen it, heel cup it. These are conservative cares that are really good for acute, but you'll find in the chronic kids is that, yeah, there's a little bit of improvement. There's maybe 5 to 10% improvement, but it doesn't solve the issue. They just re-baseline. And that in these chronic kids, it's not how long they've had it. It's just that they fail conservative care, or that it's lingering a while. In a while, like I'll have kids, I'll see that I have it for years. You don't need it for years. It can be going on for weeks, but I'd say 2 weeks or more, that's a problem with Sever's. But it's not going by clock. It's just how it presents. Because if a child presents and they have that heel that's aggravated and they didn't do sports that day or the day before, this is chronic Sever's. Again, because they wake up with it, they go to bed with it. But using the Mikki device in chronic Sever's will crush this condition. So the Mikki device is not just treating it, it's not just managing it, it's eradicating it. It's a solution that makes it not just better. And a lot of products out there, like, that you're utilizing, I go on Amazon and I get some, insoles, and they're like, oh, it kind of helps and it manages, or I get these fancy shoes and oh, it helps, they're foamy, which is not great, but it helps. It manages it kind of, but it doesn't solve it. The moment they stop anything, it just comes back. So we find that with Mikki device, again, 50 to 70% improvement in 2 weeks, and it's typically controlled at 4 weeks. Fits in 80% of shoes. And that these children are not being crippled down. Right? You're not hearing, in clinic, I don't put boots on these kids. I don't cripple them down. I actually don't remove them from sports. I educate them. When they get these devices, we want them to ease into athletic activities. In the clinic, I know the lab also, they have the Sever Solutions Kit, which is how we implement it here in the office, and which typically consists of the orthotic in a pediatric night brace. And the night brace is not 100% required, but very, very, very helpful. So that kind of concludes it. I'm very passionate, obviously, about Sever's. I love this condition. And, there's a couple conditions in my life or in my work that I'm very passionate about. Severs is definitely one of them. And I really want to just educate, and I want to provide solutions for these kids because they struggle. They really struggle. And Scott can, Scott's not a physician, but he's in the lab and he's in the trenches, and he gets to hear, he gets to hear these calls, I'm sure, daily that come in from parents, because I'm seeing patients here in the state of Arizona, whereas Scott, he's all over the United States, and I think probably even international.
Yeah, I hear from a lot of parents struggle with exactly as you've said. They've been
Amazing.
Past, and after multiple years, they find us. Sorry, Brooke, go ahead.
Oh, no, that's all right. I was just going to say it's amazing. It's fascinating to hear about the Mikki device and how that works with Severs, and then also just getting a better overall understanding of Severs as a whole. So it's really fascinating to dive in today. I have been watching the chat, and it looks like we have a flood of questions coming in. So I'm going to jump in here and start firing some of those at you guys so that we can get our audience some answers here. So our first question is, how long does it take to receive the Mikki device over a custom order or custom orthotics?
Oh, I'm curious what Scott's gonna say. I know what Scott's turnaround time or what the lab's turnaround time is for me, but it might be different if you're going directly to the lab.
I'm sorry, you cut out there. It was the turnaround time for the Mikki device?
Yes, how long does it take to receive the Mikki device for custom orthotics?
Once the order is placed, it'll be shipped out within a business day, and once we receive the casts back, those will be finished and the orthotics will be shipped.
Awesome. And then Dr. Jarman, it looks like this is a question for you. Oh, I'm sorry, Scott. Dr. Jarman, it looks like this is a question for you. A lot of us grew up hearing that it's just growing pains and the child will grow out of it. At what point should a parent stop waiting for it to go away and actually start looking for something or some solutions like the Mikki device?
Yeah. This is what's frustrating from the parent standpoint, is because a lot of this is they're being told this. Parents are being told it's growing pains, they'll outgrow it, it'll go away. And this is typically no fault to providers for this. We know what we know. We're products of our teaching. We're products of our knowledge. All of us are. And from a parent standpoint, I think it's this intuition. When I see a parent here that comes in the office, these parents are not, unfortunately, they're not saying, Timmy's only had this for 1 week and here we are. It's Timmy's had this for, 2-3 months, 2-3 years. And it won't go away. So I think there's this intuition inside of you that says, maybe this isn't growing pains. Maybe this is something more. So I'm not dismissive, is that a lot of kids do have acute severs and it resolves spontaneously. But I think is that the radar is that you're doing weeks here, or it's impacting your child's quality of life. Like, that's a problem, right? And again, coming back to a simple way to just diagnose this is it Severs or not, is squeeze the heel. If that heel squeeze test is positive, it's Severs. So you then just have to figure out, is it acute Severs or chronic Severs? And that'll just be by some other manifestations, because acute Severs, we know, is going to resolve within an hour, a day, a week. It doesn't go past that. And so if a kid is chronically always complaining about something to do with their feet, and they have a positive squeeze heel test, it's Severs, and it's chronic Severs. And then the connection is, how are you going to treat it? Are you going to immobilize your child? Are you going to cast them? And again, that's how I used to do it. And unfortunately, a lot of doctors still do that because they just don't know. Or are you going to put an orthotic on here? But if you're going to put an orthotic, you have to have this modification. It will make or break every case of Severs. Unfortunately, you'll either get mixed outcomes or you get failure. And you're going to invest a lot of money in an orthotic from providers. They're not cheap, as you can probably assume. The lab is much cheaper than a medical office, but They're not cheap. And when you're making that type of investment, you want to make sure you're accurate with your diagnosis so that you get the best outcome.
Amazing, amazing. To follow up on that question, let's say a parent does suspect that their child has Severs. Do they need to make a doctor's appointment or have a doctor's visit in order to order the Mikki device?
Well, I'll answer that, and I'll kind of punt it to Scott because obviously the lab works differently, I know. But on my end, when you're working kids up for Severs, it's obvious to me what it is because I see it every day, and it's not obvious and sometimes a good workup, but it isn't. Not everything is what we think it is. So I think is when you're in complicated cases with kids that just, because a good workup from a physician is good, but if the intuition is that it's Severs, because let's say someone comes in, they've had it for years and they've been worked up with other providers, and even if they've had an orthotic, but it wasn't necessarily Mikki device, and I think it's Severs, I still treat them for Severs because that's the way to go, because the other things that it could be are very difficult to discern or work out, and you really have to eliminate Severs. You have to eliminate that. So the go-to, unfortunately, is always going to be chase the Severs, and if you were using the wrong modalities, you weren't treating the condition correctly, so you weren't really even going to get better anyways. And so on my end, there's always going to be workup, because as we dispense them, we want to be accurate with the diagnosis because we want a good outcome with the orthotic. I'll punt that over to Scott.
As far as it goes on our end, acquiring the Mikki device, we offer it online through our website, pediatricorthotics.com, and we don't require a prescription or referral. You can just buy it directly if you believe that your child has Severs. You can try it out, and because of the fact that we guarantee it, you can try it with confidence.
Wonderful, wonderful. Thank you so much for that, both of you. Another question here that we have from one of our parents is, one of the hardest things to do is to tell a kid they have to sit out a season. Does a Mikki device mean that an athlete can keep playing through Severs, or is it more about recovery after they've taken a break?
Yeah, and I may allude to this a little bit with the presentation, but when I diagnose someone with Severs, it's to understand is that the bone's not broken. It's just that growth plate is really angry, super, super, super angry. So as long as they continue to do their athletic activities, they're always going to find that they're struggling. But it is a game-changing event when we put this orthotic on them. So we put the orthotic on them, and now the pressures are being moved. It's equivalent to like having the boot on. It's protecting that growth plate. So I actually don't remove them from sports. I don't tell them they cannot do sports. I just say use good judgment, but they're able to go back to athletic activities. But we do want that orthotic for that first 4 to 6 weeks. We want them to wear it all the time in everything they do. We wanted to wear them in their cleats, their athletic activities. We want them to wear it when they're at home, walking around the house. We don't want them barefoot. And we do like to complement it, obviously, with an athletic running shoe, like New Balance and ASIC, Brook kind of thing. And like steer clear of like Crocs. Crocs don't make it worse, Severs, but they do not make it better. You're just kind of stuck. But if it's between walking barefoot and wearing Croc, of course, wear a Croc. But again, going back to the question, I don't remove them from sports. I don't find that's necessary.
Awesome. Thank you, Dr. Jarman. To follow up on that question, I heard you mention that they can use it in their cleats or in their everyday shoes. Do children need a Mikki device for every pair of shoes, or can they swap between their school sneaker shoes and their game day cleats?
Yeah, great question. I do not make a recommendation that they get multiple pairs. They can, of course you can. As an adult, right, I wear orthotics. I have multiple pairs. I have multiple shoes, and it's just super convenient. But I also am doing full length orthotics. And, orthotics in adults are typically more of like, for long-term type of deal. In the pediatric, this is a condition that's controlled. It's 3/4 length. It moves very easily in and out of shoes. But we also can find is that you maybe times where you just don't need the orthotic, meaning like once it's controlled after that 3 to 4 months, well, we do say continue to wear, but maybe you only just wear it in your day-to-day shoes. So if that makes sense, is that you don't really need 2 pairs. But if you think you want 2 pairs, I know here in the clinic is that we will tell the lab to hold the molds if the parent is maybe wanting 2 pairs, so the lab can fabricate another pair.
Awesome. Thank you so much. And then how would a patient or client go through the process of making a mold for custom orthotics, or how does the office go through that process?
Yeah, in the office, we use STS socks to take a mold of their foot. And these are like fiberglass socks that are very great at accurately molding around the foot. Because the thing of like an orthotic is like glasses, right? So orthotics kind of all look the same, or glasses all look the same, orthotics all look the same. But, my glasses have a prescription on them. And so orthotics are like a prescription. So you have to have a perfect mold of that foot. And that's what makes them successful for moving pressure around and not having hot spots and stuff. Because that's the number one cause of pain in orthotics is that it's a poor cast. So if you get an orthotic and you're like, these just hurt to wear, it's because the mold is bad. You get a mold that's perfect. It's like putting a dental retainer in. It just fits, right? But we cast, and you have to have the accurate mold. So when we provide that to the lab, if you don't have that accurate mold, and we're also positioning the foot, that is kind of crucial or helpful. It's definitely more crucial with flat feet stuff than it is, but getting a good mold is gonna just guarantee you get an excellent orthotic.
Awesome. Thank you so much. And it looks like we have one final question. I believe this one will be for Scott, but Dr. Jarman, if you would like to hop in, feel free. Our last question is going to be, what makes pediatric orthotics different than other orthotics companies?
Oh, the unique thing about us is that are the same devices that are used in local podiatrist offices, prescribed locally, are available. We make those available online for children and parents to purchase. So aside from the uniqueness of the Mikki device, which has been discussed, just making them as widely available as we do is how we're unique.
Love it. So it sounds like it's very easy to get your hands on it once you figure out that it's something that you need. So that is a great commodity to have there. It looks like that is the end of our Q&A and the conclusion of the webinar. Thank you all for joining us today and for your excellent questions. And a special thank you to Scott Kelly and Dr. Mikkel Jarman for sharing their expertise and taking the time to really sit down and answer everyone's questions today. We hope this session has been helpful, and we wish everyone a great day.
Awesome. Thank you for your time, guys.
Thank you, everyone.